Jeremy Jędrzejkowski, welcome to Rzeczpospolita headquarters at Economic Forum in Karpacz. And we will be discussing now one of the most important areas of our lives, that is health. Healthcare remains one of the most challenging areas as far as quality of our lives is concerned. How to implement the latest technologies and most efficient solutions in order to prevent health and perhaps lives of patients in Poland. I'll talk about it with my guest, Monique Clua Braun, Country President Novartis Poland. Hello, nice to meet you here. It's nice having you here.
Thank you so much for the invitation.
And tell me, what is the role of pharmaceutical companies like Novartis in the process of shaping modern healthcare system?
Yeah, I believe as innovative companies, we have like very different roles, right? And the first of it, it's of course to ensure we bring new drugs, state of the art, to the world. And for that, I mean, companies like Novartis, who is very active on the research and development area, continue to pave the way forward. And this requires like a big effort, not only in money, but just for you to realize that one innovative therapy needs on average up to 12 years to be developed and discovered, and of course huge amount of money. So there's many different roles. Of course, it's like the discovery, then how you really do like the clinical testing, which I'm also very happy to see that we're doing here in Poland. But then when it comes on how to bring this drug actually like to the market and to the patients who need it, there are multiple roles we need to fulfill. One of those is the education, not only of the HCP and healthcare practitioners, but also of the patients.
And the modern healthcare system should be also resilient. What is key to this to improve this indicator?
Yeah, I think like resilience is one of the activities we all try, and one of the muscles we try to exercise. I believe modern healthcare needs, on the one side, more partnerships to be established. We need to work together because we realize that we have huge challenges ahead. Second, we need to leverage the usage of data and technologies that are available, even with small steps, to ensure that a patient referral can go quicker, for example, that the integrated healthcare is also being considered and shaped for the future.
And what is the direction, the key direction Novartis is leading healthcare?
So we're like very active into 5 top therapeutic areas, but I would highlight one that is cancer care. And when it comes to cancer care specifically, you will see that we have been quite active in the area of breast cancer, which is one of the leading causes not only of mortality, but also 26% of total female cancers are breast cancer. And there we're not only ensuring that we have the proper medicine that is already available in certain markets, but also that we start with early detection. And for this, we need patients to be active, to do self-screening, especially mammography, where we see that in Poland we still have like a big way to go because like the number of screening is still not to the level of region Europe. And then of course to ensure that we leverage all what's happening in Europe, right? When it comes from the clinical research piece, when it comes like to the European settings on how drug can be developed and also trained in the different countries.
And what's more, I want to ask you is, radioligand therapies are set to change the treatment paradigm. So in what therapeutical areas Novartis is active when it comes to these therapies?
So for sure, radioligands is one of the state-of-the-art platforms, not even technology, but platforms that is coming to stage right now. We're currently present with 2 of our products, especially in endocrine tumors, and the second one is in prostate cancer. But for sure, these radioligand therapies continue to be developed. Novartis is the leading company there, not only having brought already the first one to the markets, but also acquiring different types of technologies, other types of radioligands, and most probably this is going to be one of the platforms we will see in the future impacting beyond these 2 cancers, but also going to gastroenterological, lung cancer, I mean, many more to come. So I'm really very hopeful to believe that this could be really one of the big solutions for cancer worldwide, and of course also in Europe.
So new technologies, new resolutions are very important for care, and that is the topic. I was talking to my guest, that was Monique Clua Braun, country president Novartis Poland. Thank you very much for coming. Thank you very much for having you here.
Thank you so much for the invitation.